All right, so what we're going to cover today are most common equine emergencies that we see in our area, plus a few uncommon ones that you may come across, may not ever come across with your horse, hopefully not. When to call the vet, what you can do, and how to try to avoid the same issues in the future. We'll go over first aid kits a little bit for having your own, what we include in ours, all of that. And then we'll practice hands-on skills at the end, get a couple horses in here and practice any of the hands-on skills that you guys want to practice with that. So some common equine emergencies that will cover colic, lacerations, other injuries such as fractures, nail in the feet, porcupine quills, little things like that, acute lameness, rattlesnake bites, choke, eye injuries, tying up, down horses, dystocia, and sick foals that we'll touch on a little bit. That could honestly be a whole lecture by itself with the reproduction and the sick foals, but we'll touch on it a little bit. Working here. There we go. So first one that we'll start with is colic, which is by far and away the most common equine emergency that we see that horse owners will deal with their horses. So we'll go through what is colic, what are the common signs of it, what causes it, and then obviously what you can do, what we do with it. So colic is any type of abdominal pain. It can be associated with any internal structure in the abdomen, most commonly stomach, intestines, things like that, but you can also have a horse acting colicky if they have kidney pain, if they have bladder pain, anything that's that visceral type of pain within the structures of the abdomen can cause colic symptoms, but most commonly what you would think of with stomach pain. The signs of colic are excessive pawing, excessive sweating without having done any work, lack of appetite and or thirst, laying down, rolling infrequently, kicking or looking at their belly, being kind of lethargic and off feed, maybe not passing manure, sometimes stretching out as if they want to urinate but not, and then having an elevated heart rate and respiratory rate. So there's many things that can cause colic. Includes sudden feed changes, weather changes, dehydration, poor dental health, if a mare recently foaled, stress, and other things that are kind of out of our control. Horses can randomly get a twisted gut. They can randomly have some intestine get stuck in the connective tissues in the abdomen. Those things we can't really control, but we can treat once it happens. So first aid for colic, number one thing that you're going to want to do is give Banamine, whether that's paste, whether you have the liquid that you are comfortable injecting. If you're not, we'll kind of cover that a little bit today, or using the oral paste, anything like that will work. But most horses are going to get a dose for a 1,000-pound animal. That's roughly the weight of an average size horse. For like our quarter horses, the thoroughbreds might be a little bit more. If you have a draft horse, obviously more, but kind of general dosing would be for about a 1,000-pound horse. So either 10 cc's of the liquid injectable, or on the paste they have the mark for the 1,000 pounds. So you would just move it to that, give your oral dose. So if it's more of a mild colic, a lot of times that will cover it. You give the Banamine, 30 minutes later they're looking good. You can just continue to monitor them. Sometimes not, and we've got to keep moving through the other things. Removing access to feed, no matter what type of colic it is, we don't want them to eat for a while and possibly make it worse. Monitor for passing manure. If they're impacted, where they have a big impaction of feed in their colon, nothing can move through, they oftentimes won't be passing any manure for the day. If they are trying to go down and roll, it can be helpful to hand walk them and see if that will help alleviate the symptoms, try to keep them from rolling, because they can twist their guts by doing that as well. And then if your horse's colic is not resolving or gets worse after Banamine, after pulling feed, you notice any more concerning signs starting, then definitely call your veterinarian. So preventing colic, providing access to high quality forage and fresh, clean water. In the winter for us, it's especially important to remember that frozen water can also be a cause of colic, so that oftentimes is what leads to impactions. They get dehydrated because their water is frozen, they can't get enough water with their feed, all of that dry feed just bundles up in their intestines, in their colon, and then we have a colic situation that we need to work on. Keeping a consistent daily schedule for feeding time. Horses will do well with that. You know, it's less ulcers being formed that way, and just keeping them on a routine schedule kind of keeps their guts on that schedule as well. So you're not doing any sudden feed changes. They're not going a prolonged period of time without feed and getting that kind of acid building up that needs to be buffered, anything like that. So that will help keep their guts healthy. Keeping them up to date on deworming and dental care, for minimizing the risk of parasites leading to any colic issues. And then also if they're up to date on their dental care, they're able to chew their food better, grind it down better, have less impactions that way, less choke issues that way. Overall just helps them with their eating. We try to minimize the use of NSAIDs on them, so that's your bute, Banamine, Equiox, not really in this because it's a little safer for their guts. But bute and Banamine are safe for about a 5-day in a row period before you start running the risk of developing some ulcers with it. So if a horse needs to be on an NSAID longer term for pain or inflammation, that's when we usually switch them to the Equiox, because that will have less ulcer risk. It's specifically formulated to have less ulcer risk for them in the long term. So if you have a horse that needs to be on an NSAID, you're getting to, you know, the 3 to 5 day mark with your bute or Banamine, we're going to try to do something different with them to prevent ulcers and then prevent colic. And then preventing your horse from eating off of dirt or sandy areas that they can get sand impactions, they can get that kind of just sitting in their stomach that way, and that can lead to colic down the road as well. So our next one is lacerations. So for our lacerations, it refers to a cut on any structure of a horse's body. Not all of them are necessarily emergencies. Obviously, something like this picture would be an emergency. That's a pretty big wound that definitely needs stitches. If it's a little small cut, pretty superficial, you know, maybe just you putting a wrap on it will be good enough. So when we consider a laceration an emergency is when it's over a sensitive structure. So something like a joint, their tendons, near their eye, anything like that, we would want to look at. If it's large, deep, causing severe pain, like this one in the picture likely would be, or if it is bleeding profusely, then it's probably going to need stitches as well. So first aid for it, first of all, applying pressure to stop bleeding if there is any bleeding going on at that point. For leg wounds, for down by the hoof, especially if they cut their heel bulb by their hoof, those tend to bleed a lot. So getting a good pressure wrap on that, using standing wraps, getting a thick bandage on it to just get some of that pressure and stop the bleeding is the #1 thing to do. It's recommended to not remove that pressure bandage until advised by us, or if you're changing the bandage, you know, if you talk to your vet, they might say, that's great, keep bandaging it, but we want that pressure bandage to stay on for a day or two before we change it. Once you are cleaning the wound and doing any prep that way, just rinsing it with clean cold water. A lot of people want to use peroxide or alcohol or betadine or any of that. The betadine, things like that are okay initially if it's really dirty and you're trying to clean it out, but things like peroxide will actually be killing off some of the tissue cells, and that's going to slow down our healing process later on. So just clean cold water, saline, anything like that is best to be flushing wounds out with and cleaning them with. Then giving an NSAID, Banamine is usually preferred because we're usually dealing with soft tissue structures being injured in these cases, and Banamine is a little bit better for soft tissue pain than bute is. Keeping your horse as calm as possible, and then contacting your vet. You know, for a lot of people, for us especially, if you're texting us a picture, that's always great. We can give you pretty good advice that way, or tell if it's something that we need to see that day, or if it's something that we can kind of talk you through at home. They're so helpful.
They are so helpful.
So laceration prevention, keeping your horses in safe, calm areas when unattended, somewhere where you know that they will just stand calm, not get too worked up, that you know that there's pretty minimum objects around that they can injure themselves on. and inspecting their housing and fencing for potential hazards, anything sharp that they can cut themselves on, anything that they could trip on, anything that way that you think could maybe be an issue. Do your best with it, but horses love to injure themselves, so they'll find something, but as much as you can minimize it is best. And then training your horse to tolerate items wrapped around their legs and be able to have their legs handled is key as well. We do see quite a few horses who get their foot tangled in some wire on the ground or in a fence or something like that. They panic, and then they make it much worse by struggling to get out of it because they're either not used to having something touching their leg or they're not calm in those situations, and it just tends to make it a lot worse. So other injuries that we'll touch on would be something like puncture wounds, which is a little different from lacerations. You know, laceration referring to a cut or slice across the soft tissue, puncture actually puncturing just deep in one area into the body, and then nails in the hoof. One more thing that I'll touch on quick, I don't have a slide for it, but we do see relatively commonly are porcupine quills. In those, you know, you can try to pull them at home. If you have some Dorm gel or something like that to give them and sedate them, then I think it's fine to pull them at home. If you're trying to pull them awake, unsedated, it sucks for you, it sucks for the horse. Some of them get head shy afterwards. So if you don't have Dorm gel or any sedative at home, it's best to just call us to do that. Get it out quick. If we feel like there's any that are deep in there that might fester, we can get them on antibiotics, all that kind of stuff. So we'll go into yeah.
Really quick on the porcupine quills, so if you give them Dorm, you pull them.
Yeah.
And obviously there's going to be like tiny open wounds from where they're punctured. What do you put on them at that point?
I generally don't put anything on them. They're usually fine that way. If any break off or you can feel on them, so I'll pull all of them out and grabbing them as close to the skin as you can so that they're not breaking off. But then after I think I've got all of them pulled out, I'll rub my hand over the whole area and see if I can feel any broken ones or any bumps or anything like that. In those situations, we do want to be trying to treat those or at least putting them on antibiotics that way. But if it's, you know, recently that it happened, we get them pulled right away, I just kind of leave them and they're fine.
Okay. I wasn't sure, I couldn't remember if they like harbored bacteria in that shit though.
Not usually, no. Any other questions? Okay. So for the puncture wounds in the nail and the hoof, the treatment, signs, all of that are kind of the same. So now it's just under the category of other injuries. So either of those can cause severe lameness. You may see obvious objects sticking out from the foot or other body parts. So if they have a nail in the hoof and it's still there, obviously you can see that. If they have a stick that punctures into their shoulder, we've seen that on horses. You may or may not still have some of that stick poking out of it. But then you may only see the puncture wound sometimes too, if it was a wire stick or something like that. Oftentimes you will have swelling and heat around the area with the exception of the foot. Unless it's been going on a while, it can start to swell upwards into the leg. You might have some discharge from the wound, probably bleeding if it's been recent, and then they may be a little lethargic depending on how long it's going on. With the puncture wounds especially, they tend to get a cellulitis and an infection pretty quickly from it, and then they can spike a fever and become lethargic as well. So first aid for it, ideally we don't want to remove the foreign body, especially in the hoof. Obviously there's situations where it may be better to do that, but it does help us imaging-wise later on for figuring out where that nail may have gone for sensitive structures in the hoof, if it's still in there and we can x-ray it at that time. But not always possible, and sometimes they don't have it in there anyway. You just find the puncture into the hoof. We want to keep horses as calm as possible and reduce movement, especially if they do have something in their hoof or if they have a puncture near a sensitive area. Giving a NSAID like Banamine, once again, is preferred because it's usually soft tissue that we're dealing with. The puncture in the hoof might be better to do bute because we might be dealing with more bone at that point. You can apply a bandage as needed to it if it's on the leg or somewhere that's easily bandaged, and then contacting your vet to let them know what's going on. Once again, pictures are great for us. If it is a nail in a hoof, we want to see it right away so that we can try to take those x-rays with the nail in the hoof, or at least get aggressive with treatment right away. And even for minor punctures that we may have you be treating at home, still they're probably going to need a tetanus booster if it's been more than 6 months since they've had a tetanus. So even in that case, we may end up coming and seeing them just for that. So things that can cause acute lameness would be things like our hoof abscesses, laminitis cases, and then fractures. So hoof abscesses are infection in the hoof causing inflammation and pockets of purulent material or pus that build up a lot of pressure, and then the horse will be almost fracture lame with it, not wanting to put weight on their foot or anything like that. It looks really scary and severe because they have all that pressure and it hurts them to step on that hoof. So once we get it open and draining, it's almost immediate relief and they're walking much better after that. These aren't necessarily an emergency where the vet needs to come work on it if you're comfortable doing the care with it, and if you're comfortable trying to get it opened up a little bit for that drainage, but it is urgent and at least requires you to do immediate care at home with it. So signs of a hoof abscess, like I said, severe lameness where they're three-legged lame with it. You'll probably feel heat in that affected hoof compared to the others. Increased digital pulses, which we can help you guys on the sample horses feel today if you've never felt the digital pulses down by the foot. Swelling around the coronary band, and you might have discharge from the sole or near the coronary band. Hoof abscesses tend to either drain out the bottom of the hoof, or sometimes they do rupture out the top near the coronary band. So things that you can do at home, doing an Epsom salt soak daily, where you just mix some Epsom salts pretty heavily concentrated into a bucket or a pan of water if they'll stand in that, and just soak that hoof for a good 10 minutes. Doing poultice bandages either with an Epsom salt paste, or they're called animal intex pads, where you just wet the pad and put it on the hoof, and that acts as a poultice too to draw things out of that hoof. Giving an NSAID, in this case I would lean towards bute since it's the hoof, more bone structures with that. Confining to a clean, dry area, and then contacting the vet or the farrier to help open the abscess. If, after initial poulticing, soaking, it's not opening up, one may have to go in there with a hoof knife and just kind of get that area open a little bit better. So prevention for it, avoid housing in wet and muddy conditions for extended periods of time. Obviously we can't always control that with the weather, pastures, pens may get muddy, but if you can at least provide some sort of drier spot with that, or if it's, a week of wet weather and then it dries out, not a big deal. We just don't want them in it for weeks at a time. And then keeping consistent quality farrier care will help just to keep the health of the hooves up to date. Removing hazards from the environment, such as nail, wire, glass, anything that could provide damage to the sole of the foot and allow dirt and bacteria to kind of seed in there and start that abscess. And then maybe worth considering hoof hardeners during extreme weather changes, like if we have a couple weeks of rain in the spring or something like that, might be worth considering something like that, or at least just continually checking the hooves for any issues. Any questions on anything so far?
Is there a certain hoof hardener that you recommend?
No, any of them seem to do as good a job as the others. Any other questions? Okay, so we'll go on to laminitis. So laminitis is inflammation within the hoof capsule, which leads to separation of the lamina from the hoof wall. So you have your outer hoof wall, like we can see on the horse for their hoof, but then you have the inner part of the hoof with the sensitive lamina that holds the outer hoof and the inner structures of the hoof together, and they're usually interdigitated, like fingers going together, and when they get that inflammation, those interdigitations will separate and allow that hoof to separate from the sensitive structures in the foot. It's obviously a very painful thing to happen to them, It would be like our fingernails separating off of our fingers. So we can imagine how painful that is, and then they have to stand on them as well. So it is very serious. It's definitely an emergency that requires immediate care to prevent worsening in the long term, and requires long-term management to prevent future episodes. They do tend to be a little more prone to getting laminitic again in the future if they've had one episode. So signs of laminitis, they're extremely stiff, they have short strided gait, they want to rock back onto their hind limbs to take pressure off of those front feet. Laminitis is most of the time in their front feet rather than their hinds, because they bear most of their weight on their front feet compared to their hinds. Once again, you'll probably feel heat in the affected feet. You'll definitely feel increased digital pulses, oftentimes referred to as bounding, because it'll be so obvious to feel. They'll be reluctant to be able to pick up one of their front feet and bear all their weight on the other one, and they'll want to lay down often. So this is a classic stance of them rocking back to take pressure off of their feet. They're most painful over the toe, so with this stance, they're taking some of that pressure off the toes on their front feet and leaning more on their heels and just trying to put their weight onto their back feet. So first aid, giving an NSAID, once again, I'd go with bute in this case, doing some sort of cryotherapy, so doing ice booths, cold hosing them, anything that way to try to bring some of that inflammation down. Moving them to a stall with some deep bedding, some sand, some deep straw, anything that'll give them a little more cushioning than being on hard, firm ground. And then calling your vet. So obviously you can get started with the cryotherapy, the NSAIDs, all of that at home. But at some point, we're probably going to need to take some x-rays to see what kind of damage is going on and make a plan from there. For preventing laminitis, the biggest thing you can do is preventing obesity in your horse, which can lead to metabolic issues and then lead to laminitis. Limit their time grazing on green grass, especially in the spring. The sugars in the grasses tend to be very high at that time, and increased sugars is what triggers the whole cascade in the body to get to laminitis. And then minimizing excess carbohydrates for the same reason. Those get converted to sugars, those cause the process. And managing any existing metabolic diseases. So horses with Cushing's, equine metabolic syndrome, or anything like that are a little bit more predisposed to laminitis, because there's usually a little bit of an insulin resistance component or things like that that affect how they process sugars as well. Any questions on laminitis? Yeah.
Could you touch a little bit on the difference between metabolic laminitis and mechanical laminitis?
Yeah, so they're going to be roughly the same. So with the metabolic syndrome, you 100% have insulin resistance in those horses. That's part of what makes up the metabolic syndrome. So with that, they are not processing sugars as well. They're more prone to having that cascade happen in the body where the sugars lead to a laminitic episode. So that would be causing a more acute episode in that case. I guess I would consider mechanical laminitis more of the lameness occurring once you get over the acute phase. So in really severe cases, when they get that separation of the hoof wall and the structures in the hoof, you can get rotation of the structures in the hoof, so their coffin bone, all their pastern bones that go into the hoof capsule can rotate downwards and separate. So normally they'd be parallel to each other. Those will rotate downwards with that separation. And so that's damage that we have to manage in the future going forward, and manage with more frequent trimming, maybe some different shoeing or pads or support that way. But those things, they may continue to be a little bit sore or lame in the future with that, without having the active initial process going on with it. And so you can manage that more, like I said, with trimming, with shoeing, just trying to even their angles back out. But it is a long process after that. So you may be dealing with it for weeks to months afterwards if it's a very severe case. Does that answer the question?
Yeah, I think so. I was just wondering, because they can develop mechanical laminitis without.
They can have laminitis without having a metabolic disease, yes. Yeah. So like spring is the most common time we see it, where a horse goes out, we get a bunch of rain, it gets really sunny, the grass is really green and lush, we have a bunch of new growth, they go gorge themselves on it. Yes, they for sure can get laminitis from that without having Cushing's or metabolic syndrome or anything that way.
I guess I was just more so wondering, because like when we use a vet diagnosed him with mechanical laminitis, but said like he didn't, it wasn't from diet, it was from shooting. And that was like really interesting to me.
Okay. Yeah, I don't think that you can really get it from shoeing, because there shouldn't be anything that way that's causing that inflammation in the hoof to cause that separation, which is what the laminitis is. So you can get other lameness from shoeing, but I guess I wouldn't call it laminitis in that case. And maybe they were just referring to maybe his coffin bone was angled, more downwards from what it would normally be, but you shouldn't really get any rotation without the actual inflammation process too. Maybe just with the trimming he had and whatnot, it was just a poor angle, but not necessarily laminitis and rotation. Anything else on laminitis? Okay, we'll go on to fractures caused by trauma. Can range from anything from a hairline fracture, where maybe your horse just looks a little lame now and then, to what you would think of as the full fracture, broken leg, open skin, the whole big bad thing that we never want to see. Always an emergency. We want to provide immediate care to prevent worsening and minimize suffering, especially in those really severe fracture cases. So signs of fracture are severe lameness, but like I said, in the case of hairline fractures, you may actually not know that there's one, which is why x-rays are important. Most of the time though, severe lameness, swelling and heat over the area. If it's a pretty significant fracture, you can feel crepitus, which is kind of a crackling. If you're feeling on the skin, kind of a little crackling that way. Instability of the limb if it's a severe fracture, plus or minus broken skin, depending on how severe it is. So in these cases, trying to keep your horse as calm as possible, to minimize them moving around on it, giving them some pain meds. So since we're dealing with bones again, I would go towards butte over anything else. But with that caveat, I'm saying for each one which one I would prefer. If you only have one or the other, it's going to work fine. But if you have both, these are the ones I would go with. Stabilizing the limb if possible with a thick bandage or a makeshift splint or anything like that. Doing some cryotherapy to fractures on the body and skull, so you can get fractures up there as well if they hit their head on something that aren't something that you can bandage, but we're going to try to treat the pain, minimize the symptoms with anyway. And then obviously calling your vet, because we're definitely going to need to see these and do some work on them. Prevention, unfortunately, very little we can do to prevent. Most of them are a result of trauma, an accident, a freak deal that happens. Some things that you can do are separating horses that don't get along, that might be kicking at each other. That's the most common way we see fractures, is getting kicked by another horse. Inspecting pens and pastures for hazards again, so minimizing holes that they can catch their foot on and trip in, anything that they can get their legs tangled up in, anything that they could hit their head on, anything like that. And then just keeping your horse in good condition. Older, weak horses, skinny horses are a little more likely to have some sort of accident that leads to a fracture. Also, in the winter, for ice is another thing we need to keep in mind for the possibility of them slipping and getting a fracture that way. Just trying to minimize any slick areas as much as you can. So for rattlesnake bites, this is a pretty common view of what we see after a rattlesnake bite. They will most commonly get bit on their nose because horses are out in the pasture grazing. They have their nose to the ground. They come across a snake, get bit on the nose. They can get bit on the legs and whatnot too, which aren't as big of an emergency, still something to treat. but getting bit on the nose is 100% an emergency for horses. Horses are obligate nasal breathers. They can only breathe through their nose. They cannot breathe through their mouth. So when they get bit by a rattlesnake on the nose and it's swelling their nasal passages shut, that's a big deal. So you'll see swelling of the bitten area. You might see some serous or bloody discharge from the bite area. If they got bit on the nose, you'll start to see some difficulty breathing as they get swollen around their muzzle. And then you might see some excessive bleeding or difficulty clotting, just depending on what type of side effects you're seeing from the rattlesnake bite. So once again, trying to keep your horse calm and quiet. They will start to panic a little bit as their nasal passages get swollen and their airflow is affected that way. Trying to maintain open airways, so it's a good idea to keep either, like on this previous picture, you can see kind of at the bottom, those are syringe cases that the end was cut off of, so it's open the whole way through. You can put those in their nose to open the airway, or having like some 6-inch pieces of garden hose or something, some sort of soft hose too on hand that you can put in their nose quickly before it swells up completely. So maintaining their open airways, just because they will continue to swell, and then we don't want to get to the point where we're having to do like a tracheotomy on them to keep their airway open. Giving an NSAID, Banamine is going to be preferred again in this case because it's soft tissue. And then calling your vet so that we can get there, assess the situation. If they're panicking too much to, let you put anything in their nose, we can sedate them, different things that way. It's not recommended to apply ice to the area. If it's on a leg, not recommended to apply a tourniquet or try to suck the venom out or anything that way. We don't want to disrupt the blood flow around that area at all. They're already going to get some tissue damage from the bite itself, and maybe slough some tissue afterwards with it. So if we're icing it and slowing that blood flow through the area, if we're doing a tourniquet, anything like that, it's not really helping in the long term. And horses are big enough animals that it's not going to be the venom that's going to really harm them or kill them in these situations. The biggest concern is their nasal passages swelling shut. So there's very little options to prevent snake bites. We can't control where the snakes go, but we can try to minimize, how much they're around the places that we keep our horses. So trying to minimize rodents around the horses' environment so that snakes aren't coming in to eat those. Inspecting pastures for snake dens, monitoring horses closely during snake season, just so if they do get bit, you can get on top of it right away. A lot of people ask us about the rattlesnake vaccine. It's kind of variable whether it works or not. It's made as an anti-venom to a type of rattlesnake that we don't have in Montana. So there may be a little bit of crossover there, but it's not going to be as effective. And once again, for horses, we're not necessarily worried about the venom spreading through their body and killing them. It's just more the side effects afterwards. So I personally don't recommend the rattlesnake vaccine. I don't think it's worth the money for it. Some people do it. Any questions on rattlesnakes? Okay. So we'll go on to choke. So a lot of times when you think of choke, you think of your actual trachea, your airway being obstructed, not able to breathe. That's not what we're referring to for horses for choke. For them, we're referring to the esophagus being obstructed, which disrupts their ability to swallow. You may still get a little bit of their airflow being affected, depending on where the obstruction is at in the esophagus. It could be pressing up against the trachea and restricting airflow a little bit, but it's not completely obstructing it. They're not going to, pass out from lack of air or anything that way. So signs of choke, they may be stretching their neck out, frequent coughing, keeping their mouth wide open while they're coughing. They'll have discharge and feed stuff coming from their nose. Most frequently, you'll see, like with hay or alfalfa pellets or things like that, just kind of this green discharge with actual feed material in it coming out of their nose. They'll be drooling a lot. They may be kind of restless, maybe a little bit panicked with it. They won't want to eat or drink anything. Sometimes they might want to drink something, but it's pretty rare. And then you may or may not see, depending on where the obstruction is, a little left side of their neck where their esophagus runs. If it's a higher up obstruction along the neck, you sometimes can see it, sometimes can feel it, but then keep in mind that their esophagus also goes all the way through their thoracic cavity to their stomach, so you can be choked down there in the esophagus too, and you would never see it. So first aid for choke, removing all food and water. Even if they do decide they want to try to eat or drink, we don't want them doing that because it can't go down the esophagus anyway. It's just going to make the problem worse. You want to try to keep them calm with their head lowered. So once again, if you have some dorm gel on hand or something that way, that would help a lot in this situation. Mild cases of choke can sometimes resolve on their own once the horse relaxes and has their head down for a little bit, and they'll just slowly, with swallowing, work it backwards. You could try to feel for a blockage on the outside of their neck, like I said, and sometimes it helps to gently massage it and kind of break up that little food bolus that's causing the issue. But I would be cautious with that. I wouldn't be too aggressive about it because the esophagus is already going to be irritated from this. We don't want to irritate it further. Then definitely call your vet. We're oftentimes going to need to come out and pass a tube, whether it seems like they've resolved the choke or not, just to make sure that there isn't another spot further down in the esophagus that is still choked. And we do not recommend trying to clear the obstruction yourself with a hose. There are some people that, try it. I don't like it for multiple reasons. If you're not experienced with it, you can pass the hose down the trachea, and then you're putting water into the lungs, which is obviously not going to be good later on. You can cause extra irritation to the esophagus. You can rupture the esophagus with the hose if you're being too aggressive trying to pass it past the choke. So for that reason, definitely call your vet in these situations. Prevention, once again, good dental health is key. Getting regular dental exams and floats, making sure that they can grind their food appropriately, break it down well enough before it's even going down the esophagus, is the biggest thing for this. In our older horses that may not have much for teeth, we can be assessing that each year, letting you know if they maybe need to stop having hay and go to something of just being on senior feed or things like that, depending on what their dental health is looking like. Allowing access to clear fresh water at all times so that they are keeping their feedstuffs moist when they're eating it, so that they are flushing things down their esophagus appropriately. Once again, in the case of older horses, maybe soaking some feed if they have few or no teeth, going to a pelleted feed like senior feed, making sure treats are given in appropriate sizes if they don't have much for teeth to be chewing them, and then giving feed in hay nets to prevent horses from eating too quickly. If you have a horse that just loves to go gorge their feed right away, they just inhale it, they might benefit from a net to just slow them down a little bit, get little small bites at a time. Any questions on choke? Okay. Go into eye injuries. So any trauma to the eye is an emergency. We want our horses to keep their eyes as much as we can. We can take them out, but we don't like to. So this picture is a really good picture. It shows a lot of these symptoms that we're talking about here. So you have kind of the squinting going on. You have swelling with the tissues around the eye. You might get excessive discharge, so a lot of tearing, a lot of this wet tear staining around the eye. They may be rubbing their eye on fence or walls or anything like that because it's irritating to them. You might see some cloudiness of the eye, like that. You might see some redness of the conjunctival tissues around the eye, which you can't really see on this picture. And they'll often be light sensitive, which kind of goes hand in hand with the squinting on it as well. So we want you to call us immediately. They are an emergency. They're very painful for the horses. We want to get on top of them right away to save their vision, save the eye, all of these things. You can go ahead and give an NSAID right off the bat before we get there, just to get on top of the pain for them. That will actually make it easier when we do get there because they won't be as painful for us having to touch the eye and work on it. I would go with Banamine again in this case because it's a soft tissue, visceral type pain that we're dealing with. Reducing exposure to sunlight and dust. Like I said, they are light sensitive. Like a day like today when the wind is whipping, it's blowing dirt around, that's not going to help anything with an eye injury. And then you may be able to start eye meds if you have them on hand already, but we want you to discuss that with us first. There's two main eye ointments that we use for horses. So one is just a straight antibiotic eye ointment. One is antibiotic and steroid together. And so you may have one or both depending on if you've dealt with eye injuries in your horse before. But if we're dealing with something like an eye ulcer on the horse, we don't want you to give the one with steroid because it can make the ulcer worse and do more damage to the eye. So always talk to us before you use an eye ointment, even if you've had it for your horse before, if you've dealt with an eye injury before, just double check that with us. So prevention for eye injuries, once again, trying to eliminate anything in their environment that could cause trauma, anything that they could hit their head on, catch their eye on, minimizing dust in the environment and feed as much as possible. Once again, easier said than done when we have the wind blowing 60 miles per hour outside. And then we recommend not feeding on an open round bale without a hay net. For that reason, you'll oftentimes see horses just burying their heads in the round bale, just trying to get to that good middle section of it. But that's an easy way for them to scratch their eye on the hay when they're doing that. So having a hay net on top where they can't just bury their face in it will prevent some of that as well. If you have horses that already just have a little bit of sensitivity with their eyes, like white-faced horses, blue-eyed horses, things like that, utilizing fly masks can help as well. So that'll minimize dust getting to their eye, any light sensitivity, anything that way too. Tying up. So tying up is muscle fatigue, pain, or cramping related to exercise that can cause muscle damage in the horse. It's kind of similar to muscle cramps in people, but tends to be a lot more severe than your average muscle cramps that we would experience. So signs of it would be visible muscle spasms, reluctance to move, short, stiff gait if you are forcing them to move. They can be pretty firm and stiff through their big muscle groups, so their gluteal muscles, their thighs, their back muscles, any of those larger muscle groups on them. Oftentimes they'll have excessive sweating, a lot of times increased heart rate, short, shallow breathing because they are painful in these cases. And in really severe cases, you might note some brown or reddish urine from them as well. That's because with the muscle damage that they can sustain from this, they're getting a release of myoglobin from the breakdown of those muscles, and that gets flushed through the kidneys and then out through the urine, so you get that kind of brownish red color. So for first aid, you want to cease exercise immediately, keeping them calm, offering clean, fresh water and electrolytes. I recommend having both of them offered, and they can choose from them. They may go for the electrolytes, they may go for the clean water, but we want to offer both. We want to try to get some electrolytes in them either way, so whether they drink electrolytes, whether you have electrolyte paste that you give them, or in really severe cases, if we need to come out and be giving them some IV fluids anyway, we might also tube them with some oral electrolytes. Warm up or cool down their muscles depending on the season. You know, this time of year, we don't necessarily want to, if they're tying up, then go cold hose them outside right now. Then in the summer, that would maybe be a good thing to do. So kind of keep that in mind for just trying to help rehab those muscles as much as we can in the acute phase a little bit. We want you to give an NSAID only after you talk to us, and the reason for that is that any of the NSAIDs, bute, Banamine, all of that, the way that they're processed through the body is through the kidneys. And then, like I said, the kidneys are already doing a lot of work in these situations because of the muscle breakdown. All of those extra enzymes, myoglobin, all of that is also getting flushed through the kidneys. So we don't want to overwhelm the kidneys in this situation. So this is one where I would have you guys talk to your vet first before you go ahead and give an NSAID. just depending on how severe the case is, you know, what they're doing, how they're responding, all of that will decide that for us. And then obviously call your veterinarian. So prevention, providing a balanced diet. If they're on a good balanced diet of their forage, you know, maybe some grain or rations on top of that. That should be covering everything, unless you know that they're a little more prone to being deficient in things, or if you're in an area where the hay that you get might be deficient. You know, we have selenium deficient areas in Montana and things like that that can affect their mineral balance a little bit. Making sure they're hydrated before exercise, especially if it's in the summer, it's a hot day, being a little bit cognizant of that. Providing electrolytes after intense exercise, especially on hot days. And then reducing stressful events as much as possible for them that might already work them up and get them dehydrated, predisposed to some of these issues before you're exercising them. And then monitoring for recurring episodes. If we're seeing recurring episodes of it, we may want to test them for some different musculoskeletal diseases that predispose them to tying up episodes. A one-off once in a while is, you know, not as concerning, but if we're having multiple episodes of it in a relatively short window of time, we're going to want to look more into that. Any questions on anything else so far? So we'll touch on down horses really quick. So in these situations, your horse is down, unable to get up on their own. Could be from illness, could be colic, musculoskeletal issues, neurologic disease, anything that way. Biggest sign, obviously, is they will be laying down, unable to rise. They might be lethargic. They might be cast against a wall or another surface that's also preventing them from being able to rise up. So in these situations, you need to assess the situation first. You know, are they cast against a wall? Are they down in a field where it's muddy trying to get up? Do they have obvious injuries? You know, do they look sick? Do they look injured? Anything like that, that's all going to kind of help make the plan for how you proceed forward. When you are approaching them, always approach them from the front or the back. So approaching, you know, from the head this way or approaching from behind from the back. You don't want to be anywhere in here because they're going to be kicking, trying to get up. They may be getting panicked. They may be thrashing, anything like that, and you're more likely to get injured trying to be up around their legs. So keep yourself safe with it. You can try to halter, encourage them to get up if able to do so safely for the both of you. If not, then continue with a different plan. Call us. We may be getting other help for it. Try to make sure they have good footing. If they're in a slick area, you can try to provide them with some footing with either putting like some cat litter down or some sand or some dirt or anything like that that might give them a little more traction. Take a temperature, see if they have a fever, if they have some illness building, maybe that's something that we need to assess first before trying to get them up more. Try offering feed and water. That'll be a sign for us too, if they're really feeling that well, if they want food and water. Regardless, they're down on the ground, and sometimes you may not have known how long they've been down for, so we need to give them some supportive care that way too. Warm them up if they're cold, cool them down if they're hot, kind of season dependent for that as well, and then calling your veterinarian so that we can come assist you. Prevention, we want to monitor them for signs of illness and lameness as often as possible, treat quickly, get on top of it. If you know that they've been kind of chronically ill or chronically lame, those are things that we don't want to go on for too long because they can predispose to these situations then where they get to the point where they just lay down and they're not able to get up on their own. Allowing turnout time in a safe environment, trying to minimize any hazards that way again. If they're stalled, making sure it's large enough that they can lay down in it comfortably and not get stuck anywhere. Keeping them on level ground with good footing is always ideal, and then staying up to date on their preventative care. So annual exams where we can kind of screen for any underlying issues, keeping them up to date on vaccines, keeping their teeth in good shape, deworming, all of that is going to help. Any questions with that? Okay. So like I said, we'll just touch kind of briefly on the Dystocia, sick foal, because it could be a whole other lecture by itself. There's a lot that goes into mares and foals. But in general, mares and foals should be meeting certain benchmarks, both through the labor process and then through the newborn foal phase. So stage 1 of labor is when the uterine contractions begin up until the water breaks from the sac. So that can last anywhere from 1 to 4 hours. You may notice them being restless, pacing, laying down, getting up. So obviously in that situation, if you have a pregnant mare who's due to foal and she's acting like that, it can look a little colicky because she is going to be uncomfortable. So that's definitely something to monitor. Stage 2 is going to be your active labor, so the water breaks until the foal is out. That should take no more than 20 minutes. It should be very, very quick. In horses, if it's anything longer than that, it's an emergency. Stage 3 is from the time that the foal is out until they pass the rest of the placenta. This can take anywhere from 1 to 3 hours. If it's more than 3 hours, that's also an emergency for horses because it can predispose them to getting a laminitic episode. It can predispose them to uterine infections, a couple different things. So we need to know about that right away too. So if any of these listed here go beyond their normal time, it's considered an emergency and it needs veterinary intervention. Then for foals, we have our 1, 2, 3 rule that they need to meet. So they should be standing by 1 hour. They should be nursing within 2 hours of being born. And then they should pass meconium, which is their first poop, within 3 hours of being born. So once again, if they're not meeting any of those benchmarks, we need to be called and it needs veterinary intervention for that as well. First aid for it, begin intervention if you're comfortable and call your veterinarian if there's not any of these benchmarks being met. Assisting with labor should only be done if you're comfortable with it. Otherwise, wait for a veterinarian. If you've never pulled a foal or a calf or assisted with any of that, it's better to just wait for the veterinarian to get there. We want you to monitor the mare for any tearing of her vulva, her perineum there. Look for excessive bleeding and anything else that would be concerning postpartum. And then we want you monitoring the foal for standing, nursing, passing the meconium, normal urination, make sure that their umbilicus, their belly button isn't swollen, and for any lethargy or diarrhea. Those are all things that need to be treated immediately. Prevention for them, knowing these benchmarks for your mare and foal, knowing the expected foaling date, monitoring your mare closely, starting 1 month before foaling. If you're uncomfortable assisting with labor or doing any of that, it would be good to consider sending your mare to a veterinary clinic to foal out. And then ensuring that your mare is up to date on vaccines before becoming pregnant and during the pregnancy, providing a clean, dry environment for the mare to foal in. Any questions there? Okay. So really quick, we'll just go through emergencies versus what's urgent versus not. So emergency is something that requires care immediately or as soon as possible, ideally within the hour. So obviously everything mentioned in this lecture is an emergency. Urgent should receive care within the day, so we don't necessarily have to drop everything and get there right now, but we do want to see it that day. So acute diarrhea, an allergic reaction, a swollen leg or cellulitis, a more mild laceration where they don't have a lot of profuse bleeding, it's not by a sensitive structure, something like that. We would want to see that day, but we don't necessarily have to come right then. Then non-urgent is something that could wait for a regular appointment, wait through the weekend, vaccines, Coggins, health certificates, if it's kind of chronic loose manure, if it's they need updated on their joint injections, if it's long-term problem you've been managing, and you know there's something else you want looked at with it, those are all more non-urgent that way. So that can kind of help you make decisions that way too. For first aid kits, so basics that we would like everyone to have are an NSAID, at least bute or Banamine, ideally both. Some sort of antibiotic, sulfa tablets, the Equestrian liquid like we have in our first aid kits that we sell, anything like that, so that you have at least a 5-day supply of antibiotic on hand to get started. Some basic bandage material, kind of like what we'll have set up here too for you. Thermometer, the number one thing that we like people to do is to be able to take a temperature and give us that information on the phone. That's really helpful for us and can help us give you direction a lot better too. Needles and syringes, if you are comfortable giving injections and have any injectable, like injectable Banamine that you're going to give. And then you can kind of take a look at our first aid kit that we have over here too, and kind of see, you know, what we have included in that as well. It's good to have a reference for vitals and what each medication does, which for our first aid kits we have with the little booklet that's included with it. And then you can keep it in your trailer, your tack room, make a smaller kit to take, you know, if you're riding up in the mountains, that sort of thing. So here's our references for the lecture. Thanks to Maya for all her hard work for helping with the lecture. And thank you to Trotty by Nature for allowing us to use their beautiful facilities to have the lecture in, get out of the wind today, which is nice. Big thanks to our distributor, MWI, who donated the bandage material that you guys get to practice with today. And then big thanks to all of you for coming.